Hello, and welcome to our panel discussion on One Health. Well, today is One Health Day, November the 3rd, 2020, and I'm delighted to host this panel on One Health. But to start, I just want to update you on the concept of One Health. I know many of you may know what One Health is, and some more will be tuning in because they're interested in this. One Health, to me, is an approach, and it's an approach we use when we're trying to optimize health conditions. It's an approach we will use to situations that are at a regional level, at a global level, but it has in its background the premise that to tackle issues of health concern, we need to tackle them on multiple fronts. And there is a significant intersection between human health, animal health, and the environment we live in. And that is the overall concept of what One Health is. Now, who am I and who am I joined with today? So my name is Sean Callanan, and I'm the Dean at Ross University School of Veterinary Medicine. So I'm delighted to say I am also joined by Dr. Heidi Chumley. Dr. Chumley is the Provost of the American Universities of the Caribbean School of Medicine. And Dr. Chumley herself is a family physician. I am also joined by Dr. James Record, and James is the Provost of Ross University School of Medicine. We're all part of one big family, and that family is Callanan Global Education, and that family has a significant strand in healthcare. So today we want to talk about One Health. And first of all, I'd like to drop a question to you, Heidi. One Health, what does it mean to a doctor, to a physician? What does this concept mean to them?
Yeah, thank you, Sean. So very similar to what you said, we view One Health as a framework. It's a framework through which we see and understand how interrelated people's health is to many different things, and the relationship between people's health to animal health to the environment is a really big part of one of the frameworks that you'll hear about in medicine, which is determinants of health. We know that there's a lot more that goes into helping somebody be healthy, stay healthy, get healthy than just the own person. And One Health is a great framework to look through for both an individual and really at a community level as well.
Thanks, Heidi. And Jim, I know your background is in internal medicine. And so from that perspective as well, when did you first come across the concept of One Health as you were perhaps going through college or in the early stages of your career?
Yeah, well, for me, as a primary care internist, I think One Health is just a natural fit when you're looking at the context of care. And to be honest, the first time I remember just thinking and looking back on what the original meaning of the word physician was, right? Which comes from physis, nature. And so the idea was that while One Health is a relatively new term, the concept behind it is, millennia old, where a physician was someone who understood the natural world. It wasn't just about disease. It was really the context of care. And that was really for me, the important element as I took care of patients was to understand not just what the disease state, but what was the environment. And I think One Health presents it in a framework that really expands how most physicians are trained, which is typically a little more localized in terms of where the disease process is and what those smaller contexts. And One Health really frames it in the right way to really integrate what our environments are, right, which are multiple environments of micro to macro environments. And I think as a model, for me, it was some of the things that we talked about early on in terms of interprofessionalism and starting to connect care across multiple, not just specialties within medicine, but across professions. And then One Health takes that beyond the medical profession and moves it into a scenario where there really are no boundaries. And I think that really is the appropriate context for One Health as we move forward for all of our care educational institutions.
Jim, I love the way you brought in, the curriculum and how, as you were being trained as a physician. And I suppose in veterinary medicine, we may have come to One Health early, but we didn't know we were in the One Health area, because lots of time and I'm thinking of things like endocrinology for me as a veterinarian, we kind of focused a lot on what the human literature had, and it was built in the veterinary literature. And the other area was, we called it at the time herd health. So in other words, we would treat a farm and a large number of animals with a particular problem. And that did involve things like looking at the environment, looking at things like the nutrition. So my question now to you really is around maybe your curricula. And I know as part of our accreditation processes, we constantly have to review our curricula. And I know, Heidi, that you've kind of already been through parts of this process. And I suppose just to direct a question first to you, where in your program now are there aspects that speak to One Health?
So in many different places. I think it is hard to away from the concept of One Health, because it is ubiquitous. But there are, I think, certain places that it touches on a lot more than others. And I would say one of our primary tasks, particularly with our early physicians in training, which is in their medical sciences, is to really get to start taking a much broader view of what can actually affect people's health. So we do that in many different ways. And one of the ways we do that is by introducing the concept of One Health, that there are many things in the environment, particularly, that's a little bit to start with, many things in the environment that can affect people's health. You can look out at the west coast of the US for a great example right now about how important the environment is. And then as we help our students to begin to think more broadly about what can affect health, you then move into some very specific examples that are easy to start with: the zoonotic diseases, vector-borne diseases, concepts like antimicrobial resistance, all of the really important things. But as you're introducing them, just keeping the frame around and understanding that these are complicated problems. There are many different professionals that are working on these from different angles, and in order to really help get to the solutions that you need expertise from many different fields. And if we can get our early students through this idea that there are so many things that affect health and so many types of professionals that need to work on complicated problems, then I think we're making good progress.
Yeah, no, that is excellent. And I know, Jim, you're really looking at curriculum, and we were talking about this, and so. And you were mentioning how One Health was going to be an exciting component of it. So, where are we there? What are you thinking about? What's going to be there?
Well, I think 2020 has offered a number of different challenges, but certainly as we look at it, looking at potential for benefit. And so we've just engaged in a strategic planning process now to our entire environment, down to our mission and vision, and moving forward into a strategic plan. And within that, this holistic concept that we have in terms of how we approach our environment, our learning environment, our curriculum, our greater environment, our connections with our community partners and our communities. So for me, it's a really exciting time because we are just beginning that process now to reconceive and reimagine. And in doing so, the expectation is that the components of One Health are a prime part of where we move forward. And so as we look at our curricula that traditionally, like Heidi has mentioned, they have components of these, but haven't been as mindful of where the connection to One Health is to provide that broader context. And then as we look forward to developing this plan, it really expands the number and the types of partnerships that we could have had, but really hadn't focused on. So, that to me is the really exciting part as we move forward, to really understand the full context of health, and again, get back to that original concept of what a physician should be, is to understand one's total natural environment. And so for us, it is, the beginning of that, where we are going to be more intentional about those connections that exist within the curriculum and that supporting academic learning environment.
Thanks, Jim. That's great. And, in our veterinary program, we've been intentional about this for a number of years now. And I think we've even brought in the one health concept through almost storytelling. Mm-hmm. So in the first year, our students are exposed to what our researchers have done, and research is a story, and it can go from finding something, but realizing who you have to collaborate with in the process. It's and then suddenly discovering, I collaborated with a physician, or I collaborated with an environmentalist or a toxicologist, or all of this kind of aspect has really kind of opened their eyes to the process. And as I've said before, veterinary medicine, kind of the way we teach has been more One Health for a while. So we still have our herd health components. Heidi, I know you mentioned the zoonotic diseases, and they are huge for us, and the vector-borne diseases. And again, many people may not know, but portions of our curriculum are delivered in the Caribbean, and I think that is the setting, isn't it, for many aspects that are One Health, because the way animals are looked after, the potential vulnerabilities of the climate, the potential vulnerabilities of producing food, all of those factors are there. So our students kind of live and breathe One Health, and sometimes they have aha moments about this, and sometimes it kind of dawns on them perhaps when they have moved to the other international components of our program. So it's been great to see that. And you both mentioned and alluded a little bit to outreach in your communities, and that's been so important for our overall organization. At Talent Global Education, we want to empower, we want to educate, but we want to support people in the locations we're in. And do you have some good examples of perhaps how you've been able to use that opportunity as a teaching moment in the area of One Health? And can I ask Heidi again first, if that's okay?
Yeah, I can. Certainly, our relationships with a number of different community partners is just really important. I'd say it's just part of the fabric of AUC. We've been in St. Martin for over 20 years now, so we've had an opportunity to develop a lot of deep relationships. So I will talk about one collaboration, which was actually with the government, was with the Ministry of Health many years ago, but I think it's a great example. And it was at a time, actually a little post-Zika, when chikungunya had become quite an issue, emerging actually in, I think, after Africa, but how it gets to America generally is through the Caribbean. And one of the things that our students were able to do, twofold. One was to really help put out messages in and around mosquito control and why that was important, but then also to be some hands and legs, some additional work to walk the island, to map areas of standing water, and in doing those things, certainly we're working with the professionals and the experts that were not the physicians. These were areas that we really needed other experts to help and work with our students so they could really understand and be excellent educators in the community, but also provide assistance. And several other examples, but that one really stands out in my mind as one of my favorite collaborations since we've been there.
And that's a lovely example, because in parallel and a little bit later than you, we did a research project. It was NIH funded, looking at the potential of the wild monkey that's on the island being a vector for chikungunya, Zika, and Dr. Matt Valentine here and Dr. Patrick Kelly and many of the students were exposed to a whole different group of people who would be going out helping them set up mosquito traps and identifying mosquitoes, and a group from the University of Georgia involved. And again, it was an important project to do and an important kind of public health significance. And of course, having government involvement too. It is a great living, breathing One Health, isn't it? At that particular time, it's wonderful. And I know, Jim, your group in Barbados, again, there's been a lot of outreach to the community there, and obviously more to happen. Do you have some kind of situations where you've kind of exposed students to, or going to expose them to kind of One Health concepts?
Yeah, well, and I think for us, our excitement, even when I was talking earlier about our strategic plan, was having the government actually part of this plan and speaking at the retreat with the understanding that, yes, we are looking at this from that holistic standpoint and across a number of different ministries. We're really excited, having been translocated and just been on the island only now for a little over a year. We are excited about some of the opportunities that even some that are in right now, and a time where we're looking forward to getting back and getting more engaged. But for us, I think, as we've talked about it, the expectation is that we really want to be enmeshed in the entirety of that community. And so as we look, I would argue that we don't even want to put those boundaries on where we can go, because what we know is from that One Health concept, it really is completely wide open. And so this is the fun part, again, when we were talking about these very elements of environmental connections on Barbados as part of our retreat. And I'm really excited for us to move forward in that as just one example of how we understand the needs to make sure we're preserving that environment, and particularly on an island, right, where we are certainly worried about a number of different things, including water levels, to give an example. And so I think what's fun too about seeing the concept of One Health with students and faculty and colleagues is also the sense of advocacy that goes beyond your narrow focus, right? And seeing that and understanding some of these connections, I think it's fabulous to see now how we can do those outreaches and have that impact in areas we never really traditionally had pursued. So I think there's a lot to talk about, and I'll certainly be excited to enjoy those elements and reporting back on them as we move forward.
Yeah, and Jim, another part of kind of a version of outreach, and it's more formalized, is our ability to offer kind of further education opportunities for our physicians, for our nurses, and Chamberlain University is a classical example, and for our veterinarians is diplomas, certification, masters, and we at Ross here developed a number of years ago a master's in One Health, and we also have certification in the area of One Health. But Heidi, I also know a very strong and practical approach that you have was developing a center that speaks to kind of, I think, One Health, living and breathing again, because this area is a classical example of where One Health comes into play if someone needs to know the definition of One Health. So can you tell us a little bit about the center?
Yeah, absolutely. So the Caribbean Center for Disaster Medicine, and this, of course, as you mentioned, Sean, we're in the Caribbean. One of the things that happens in the Caribbean is hurricanes, and this center was birthed after the 2017 really vicious hurricane cycle, where both Hurricanes Irma and Hurricane Maria really did just some devastating effects across the Caribbean, and Irma particularly to Island St. Martin. It took a while to recover. So in that, the outgrowth of that, we partnered with a group of disaster medicine specialists that came from Beth Israel Deaconess, one of the Harvard teaching hospitals. And as we began to pull and put that together, you learn quite quickly that if you want to do anything, any type of response or education around a disaster, you need a wide range of professionals and a number of different types of people working in and around any type of response. And we concentrated on hurricanes in the beginning, which was just a great place to look at in the Caribbean. And in our inaugural conference, we actually did a One Health panel. We had folks from your institution. They did absolutely fabulous. Had physicians, brought in nurses as well, and had a really very good conversation about when are the types, particularly in and around disasters, hurricanes, where the groups really need to work together, and so many different examples. There are, just to give a very practical example, animals that don't have homes immediately after hurricanes. There are a lot of people and animals that have been separated. There are challenges with the water supply, challenges with the food supply, a lot of areas that again just takes a number of different professionals and people with expertise to jump in and solve immediately. And of course, the first time you want to be meeting the professionals that you really need to work with to solve a problem is long before the crisis ever hits. So one of the things we hope to accomplish with the center is helping everyone from these many different areas really know each other, so that as we encounter more crises, which we unfortunately probably will, it's a lot easier to get teams together that can really work on solving some complicated problems.
Yeah, and even, half the battle is the anticipation, that you're prepared, isn't it? Prepare is the huge big portion of it. And it would be remiss, I think, of me in this panel discussion to say that, we are the only experts at the table. It's physicians and veterinarians. We know that there's a significant other component to this. And I personally don't own the arena of veterinary care because, that is really broad. So, for instance, the human-animal bond is a One Health approach for optimal health. For many people, we know it's so important to many different people. But we also know, conservation medicine is so important, but conservation medicine is also so important for tourism. So we, for instance, here on the island, we work, on the turtle conservation. We have a significant group that work on that. We're looking at coral, how it may be affected by pollutions across the world. And it's important to kind of have those teams. But I suppose the bottom line when someone does look at One Health, they got to just look at a table and see that there is many different people around that table that bring value to the solution, isn't it? Human nursing. This is a huge component, as we see right now, in the addressing the whole of COVID, for instance. It's a huge component. Frontline workers, both physicians, nurses, but also the psychology that comes, I presume, with all of that particular area. So I suppose my one parting question, and I will start with you, Jim, is do you see One Health strengthening as a concept? Do you see it becoming stronger and stronger within curricula, around the world as we kind of build the next generation of healthcare professionals?
I look at it as inevitable. As we move forward, what we see is this kind of collapse of the barriers between so many, whether it's communities with global travel, whether it's educational elements with, our training. There's no doubt that, in my mind, that we're going to have this as part of a fundamental restructuring of how we look at the context and breaking away from our traditional silos. And I think that creates an imperative that goes beyond just the curriculum, but to some of the things you've already talked about, where, as we look at it, the academic learning environment has to also support that. So looking at programming and certificates, other non-certificate programs that help support what is part of the curriculum, but goes beyond. And in this case, what we're talking about is such a global reach that there's no doubt that you've got to start to do medicine the right way. I think in the future, we're going to see that we can't be just limited to our own sphere, and that by creating this multi-lens sphere, we actually see our own care better because of the context required. And so I would say absolutely, and that's why for us, we're looking at this not just as a curricular element, but also as a learning environment element to develop that programming to ensure we really have an inclusive community that looks within ourselves and beyond our institution for the education that we need for our students.
Thanks, Jim. And Heidi, the future rosy for One Health?
Yes. I would say the future is rosy for One Health. It's a really important concept, and to build a little bit on what Jim just said, it is about both what's in the curriculum, but even more so what is outside the curriculum, because we all know, we're all educators. The students learn what's in front of them, but they also really watch your behavior and what's going on and what you're actually doing for the real messages, right? And so I think one of the tangible things that we've been really working on at AUC is expanding our community partnerships to reach out of our traditional partnerships, which were, I would say, around like Diabetes Foundation, AIDS Foundation, to be certainly more inclusive and include different really important areas. And our relationship with St. Martin Paws, I think, is a great one, working together for both for rescue animals and also stress relief for their puppies. It's a relationship. And a new relationship, fairly new, 1 or 2 years old now, with the Nature Foundation, which is an environmentalist group there. So by expanding of community partners we have, I think it delivers a really powerful message about how important we believe the One Health concepts are.
Yeah, and as deans and as provosts of institutions, we need to talk the talk and walk the walk. But each day we are all bowled over, and I know, speaking to you before about this, about what our students actually do, unguided, but do in the name of One Health. And, you mentioned the rescue center. We have Basseterre Animal Rescue Center here, which is massively supported by our faculty and students. And, last year, I think very difficult to do this year, but having a One Health fair on the green in Basseterre, involving medical institutions, and nursing programs. It was, these are wonderful things to introduce to the community, and the number of people who kind of do this on a daily basis, who are living it, really, it has been so important. And the other place that it's becoming so important is our governments have been waking up to this whole concept that, it's very difficult working in silos, and you need to bring the right people to the table. So I am most grateful, as always, to be in your company. So Heidi, I thank you so much. Jim, I thank you so much for today.
Pleasure.
And we will keep preaching One Health. It's important. It's an important movement for all of our sakes. Thank you. Thanks everybody for listening.
Thank you, Sean.